back to part 2 of delayed ejaculation. This the second episode of delayed ejaculation. We talked about definition, we talked about what is it basically, we talked about classification, and when you need to see your doctor. When you need to see your doctor. If you have not watched it, please go and watch the previous episode of delayed ejaculation. Yes, so in this video I'm going to do something specifically on the causes of delayed ejaculation. That's what I'm going to talk about in this video. So again, if you are not subscribed, just take a minute, right, and subscribe, like the video, and please share, right, and please let's interact in the comment section. How was your experience, right, with delayed ejaculation? Maybe if you had it, how did you manage it, right, and how did you go about it, right? Yes, so I hope you learn as much as you can, right? Yes, so let's go. So basically I want to do something about causes of delayed ejaculation. So delayed ejaculation, again, as premature ejaculation, it involves a number of causes. The list is long, right? So it involves interaction of both physical and biological causes, right? Both psychological and biological causes, right? So let's start with the psychological causes of delayed ejaculation. So one is depression, as obvious it is, right? So with the depression, again, your sexual response cycle is interfered with, right? So depression is one of the main causes of delayed ejaculation, right? So when you are depressed, maybe you will not function as you will function when you are not depressed, right? So depression is one of the causes. Another psychological cause is post-traumatic stress disorder, what we call PTSD, right? Maybe you are raped, maybe earlier in life, maybe you had some trauma, right? So when you're having sex, you keep on remembering this kind of incidents, right? This can cause you delayed ejaculation, right? The third cause is anxiety, particularly performance anxiety. Performance anxiety can cause you delayed ejaculation, right? How will the outcome be taken? How will I be accepted once after the act, right? How will my partner act after this, right? So performance anxiety can cause you delayed ejaculation, right? The fourth psychological cause of delayed ejaculation is what we call low self-esteem, maybe, right? So if you have low self-esteem, you don't have that confidence, that courage, right? During sex, it can cause you delayed ejaculation, right? Yes. So maybe you have poor body image, right? You have low self-esteem. This can cause you delayed ejaculation, right? Yes. So the fifth cause of delayed ejaculation maybe is you don't the difference between sexual reality and sexual fantasies, right? This can cause you delayed ejaculation. Maybe you've been watching pornography, maybe you've been reading a lot of books of romance and whatever, and you fail to get the kind of satisfaction you imagined you can get when you have sex in real life, right? This can cause you delayed ejaculation, right? So we've talked about that is psychological causes. Another cause is medications. There's a kind of medication that causes you delayed ejaculation, right? A kind of a type of medication that when you take them, they can cause you delayed ejaculation. For example, antidepressants, right? Maybe you are on antidepressants. One of the main side effect of antidepressant is delayed ejaculation, right? So maybe you're having sex all over, you're having sex, right? And you are experiencing delayed ejaculation. Maybe you're using the antidepressant. You need to see your doctor. Maybe he or she can reduce the dosage, or maybe change the medication, all of it, right? Yes. So antidepressant can cause you to have delayed ejaculation. Maybe antipsychotics, especially the atypical antipsychotics, right? They can cause delayed ejaculation. Maybe for example, the third medication, maybe the water pills, what we call diuretics. They can cause you delayed ejaculation, right? And again, too much of alcohol, right? Too much of alcohol, long-term heavy drinking, it can cause you delayed ejaculation, right? See your doctor. right? Yes. Apart from, we've talked about psychological causes, you've talked about medication. The last cause is what we call the biological causes or the physical causes, right? The biological causes, basically, right? One, maybe you may be having a birth defect, for example, cerebral palsy. This interferes with the reproductive system, right? So, with something like cerebral palsy, you stand a high chance of having delayed ejaculation, right? Yes. So apart from that, we have surgery, particularly prostate surgery, right? Maybe you had a BPH and you undergone prostate surgery, particularly what we call the transurethral resection of the prostate, right? This is increases the risk of having prostate delayed ejaculation, right? Prostate surgery, right? Another biological cause of delayed ejaculation is neurological conditions. For example, you have something called diabetic neuropathy. You have something we call a stroke, or what we call cerebral palsy, cerebrovascular accident, right? This can cause you delayed ejaculation, right? Yes. So when you maybe have certain birth defects, you undergone prostate surgery, you have some neurological condition which you've talked about, you stand a high risk of having delayed. You stand a very high risk of having delayed ejaculation. Another biological cause is what we call uh, apart from what we have talked about, another biological cause of delayed ejaculation, we have urinary tract infections. You stand a very high risk of developing delayed ejaculation if you have UTIs, right? Particularly infection of the urethra, what we call urethritis, but infection of the prostate, what we call prostatitis. Again, you need to see your doctor, right? He or she may recommend certain medication, and this may help you, right? So as far as that is concerned, we've talked about psychological causes. We've talked about certain medication that can make you to have delayed ejaculation, and we've talked about biological causes, right? Yes. So maybe if you are having this kind of causes I've mentioned, you really need to see your doctor as early as possible, right? So that he or she may recommend for the right kind of treatment, right? Yes. So I hope you learned something. I hope it was some sort of learning. Let's continue interacting in the comment section. Tell us, how was your experience? How did you handle this kind of situation, right? Yes, because this delayed ejaculation occurs in many occasions, right? Yes. So I hope you learned. If you have not subscribed to the channel, please subscribe, like, share the video to your friends, maybe for them to learn as much as they can, right? And please remember to comment in the comment section, right? Yes. See you on to the next video. I'm going to do something about the risk factors of delayed ejaculation. I'm going to talk about complications of delayed ejaculation, and finally I'm going to talk about treatment, right? So subscribe and so that you remain tuned for the next episode. Yes.